Let me tell you something I noticed after more than 30 years of taking care of people in their final chapter of life. There comes a moment when the body begins to whisper its intentions before it speaks them out loud. I have sat with hundreds of families in examination rooms and hospital corridors and living rooms that smell like old furniture and medication, and I have learned to recognize the signs that most people miss until it is already too late. These are not the dramatic moments you see in movies. They are quiet, they are subtle. They arrive like shadows lengthening across a room as the sun moves lower in the sky. And if you know what to look out for, if you understand what your loved one's body is trying to tell you, you can prepare yourself emotionally. You can make their remaining time more comfortable, and you can avoid the shock and guilt that so many families carry with them long after someone has passed. I want to share with you today 7 signs that an elderly person may be approaching their final year of life. This is not about fear. This is not about giving up hope. This is about awareness, about compassion, and about honoring the natural progression of life with dignity and understanding. The first sign I want you to notice is a change in their relationship with food. Now, I am not talking about someone who skips breakfast one morning or loses their appetite for a day or two because they are not feeling well. What I am describing is something deeper and more persistent. After decades of medicine, I began to notice a pattern in my patients who were entering their final year. They would sit at the dinner table and push food around their plate. They would take a bite or two and say they were full. Their favorite meals, the dishes they had loved for decades, would suddenly hold no appeal. Family members would tell me they were worried, that they had tried everything, that they could not understand why their mother or father or spouse had stopped eating. And I would explain to them that the body knows things the mind has not yet accepted. When someone is nearing the end of their life, their metabolism slows down dramatically. Their body no longer needs the same fuel because it is not rebuilding tissue the way it once did. It is not fighting to maintain muscle mass or bone density or cellular regeneration at the same pace. The digestive system itself becomes less efficient. Foods that once brought pleasure now feel heavy and uncomfortable. This is not stubbornness. This is not depression, although depression can certainly play a role and should always be evaluated. This is the body's way of beginning to let go. I have seen families become desperate, almost forcing food on their loved ones because they believe that if they can just get them to eat more, everything will be okay. But what I learned over the years is that sometimes the kindest thing we can do is respect this change, offer small portions of their favorite foods, make meals pleasant and social rather than stressful, and understand that nourishment at this stage is as much about comfort and connection as it is about calories. The second sign is a shift in sleep patterns that goes beyond typical insomnia or restlessness. I am talking about someone who begins to sleep more and more during the day, who seems to be drifting in and out of consciousness, who no longer maintains a clear boundary between waking and sleeping hours. When I visit patients in this stage, I often find them dozing in their chair in the middle of the afternoon, waking briefly when someone speaks to them, then slipping back into sleep within minutes. Their family will tell me that they used to be so alert, so engaged, and now they seem to be somewhere else most of the time. What is happening inside the body is profound. The organs are working harder to perform basic functions, and that effort is exhausting. The heart is pumping less efficiently. The kidneys are filtering less effectively. The brain is receiving less oxygen. All of this creates a kind of fatigue that no amount of rest can truly relieve, because it is not the fatigue of exertion, it is the fatigue of systems beginning to shut down. I have also noticed that many people in their final year begin to sleep at night in a way that looks different. Their breathing becomes irregular. They may have periods where they stop breathing for several seconds and then suddenly gasp and resume. This is called Cheney-Stokes breathing, and it is a sign that the respiratory center in the brain is losing its steady rhythm. Family members find this terrifying when they first notice it, and I understand why. But I always explain that the person sleeping is usually not in distress. Their body is simply adjusting to new limitations, and sleep becomes a refuge, a place where the struggle is temporarily suspended. The third sign is a withdrawal from social engagement and activities that once brought joy. I have watched this happen so many times, and it always unfolds in the same gentle, gradual way. Someone who used to attend church every Sunday stops going. Someone who loved playing cards with friends starts declining invitations. Someone who looked forward to family gatherings begins to seem uncomfortable in crowds, preferring to stay in their room or sit quietly in a corner. At first, families assume this is loneliness or depression, and sometimes it is, which is why I always recommend a thorough evaluation. But often what I find is that the person is not withdrawing out of sadness. They are withdrawing because the energy required to maintain social connections has become too great, and they are instinctively turning inward. This is a psychological and spiritual preparation for death that happens in many cultures and many species. Animals often seek solitude when they are dying. Humans do something similar, though we tend to be more conflicted about it because we live in a world that values connection and engagement. I remember one patient, a woman in her 80s, who had been the life of every party, who told me very clearly one afternoon that she just did not want to see people anymore. She said it kindly, without anger, but with a firmness that made it clear she had made a decision. Her daughter was heartbroken, thinking her mother was depressed or giving up. But when I spoke with the woman privately, she told me she was not sad. She said she was tired of performing, tired of pretending she had energy she did not have, and that she needed quiet and peace. I have come to understand that this withdrawal is not rejection. It is a form of self-care in the final stage of life, and honoring it while still offering gentle presence and love is one of the most respectful things we can do. The fourth sign is a noticeable increase in confusion or disorientation, especially in someone who has been mentally sharp. This is different from the slow progression of dementia that unfolds over years. What I am describing is a more sudden or rapidly accelerating decline in cognitive clarity. A person who has been managing their own medications and finances suddenly cannot remember what day it is. They start asking the same questions over and over within minutes. They may not recognize familiar places or may become convinced that they need to go somewhere, often talking about going home even when they are already home. Medically, this happens because the brain is extremely sensitive to changes in the body's internal environment. When the kidneys are not filtering waste products effectively, toxins build up in the bloodstream and affect mental function. When the heart is not pumping efficiently, the brain receives less oxygen. When infections develop, even mild ones like urinary tract infections, they can cause profound confusion in elderly individuals. Dehydration, which is very common as people stop drinking enough fluids, also impacts cognition. I have seen patients who were lucid and conversational one week become deeply confused the next, and often this signals that multiple organ systems are beginning to fail. Families find this particularly distressing because it feels like they are losing the person before they have actually died. The personality they knew, the memories they shared, seemed to slip away. I always encourage families to continue speaking to their loved one with respect and affection, even when the person seems not to understand, because hearing is often one of the last senses to fade, and the emotional tone of a voice can provide comfort even when words no longer make sense. The fifth sign is a change in skin color and temperature, particularly in the extremities. I learned to look for this early in my career, and it has never failed to indicate that someone is declining. The hands and feet become cooler to the touch. The skin may take on a mottled appearance, with patches of purple or blue, especially on the underside of the arms and legs. The fingernails and toenails may develop a bluish tint. What is happening is that the cardiovascular system is prioritizing the vital organs at the center of the body, the heart, the lungs, the brain, and pulling blood away from the periphery. This is the body's survival mechanism, an attempt to keep the most critical systems functioning as long as possible. When I examine a patient and feel their cold hands, when I see that mottling pattern on their skin, I know that circulation is compromised and that we are likely in the final months or weeks. I also pay attention to changes in the skin's overall appearance. It may become thinner, almost translucent, showing veins more prominently. Bruises may appear more easily and take longer to heal. Pressure sores can develop quickly, even with good care, because the skin has lost its resilience. The body is no longer investing energy in repair and regeneration. It is conserving what little it has left for the most essential functions. The sixth sign is a shift in breathing patterns beyond what I mentioned earlier about sleep. I am talking about breathlessness that occurs with minimal exertion or even at rest. Someone who could walk to the bathroom a few months ago now becomes short of breath just sitting in a chair. They may breathe rapidly and shallowly, or they may take long, labored breaths with visible effort. Sometimes there is a rattling sound in the chest, which families often find very disturbing. This happens because fluid accumulates in the lungs as the heart fails to pump effectively, or because the person no longer has the strength to cough and clear secretions. The respiratory muscles themselves, the diaphragm and the intercostal muscles between the ribs become weaker. I have sat with many families who ask me if their loved one is suffering, if they are gasping for air, if they are in pain. And what I can tell you from both medical knowledge and from asking patients who are still able to communicate is that the sensation is often less distressing for the person experiencing it than it appears to those watching. The body has remarkable mechanisms for reducing the perception of breathlessness as oxygen levels drop, releasing natural endorphins and other chemicals that create a sense of calm. The seventh sign, and perhaps the most profound, is what I can only describe as a shift in awareness or consciousness, a sense that the person is already beginning to exist in two worlds at once. I have heard this described by family members in so many ways. They will tell me their loved one speaks to people who are not in the room, often deceased relatives or friends. They may reach out their hands as if greeting someone. They may talk about preparing for a journey or packing their things. They may speak about seeing beautiful places or feeling peaceful in a way they have not expressed in years. Medical science explains some of this as the brain's response to decreased oxygen, to metabolic changes, to the natural release of neurochemicals as the body shuts down. But I have been doing this long enough to tell you that there is something more happening here, something that transcends pure physiology. I have seen people who were agitated and restless suddenly become calm after one of these experiences. I have seen people who were afraid of dying express a sense of readiness and peace. Whether you interpret this through a spiritual lens or a purely biological one, The important thing is to not dismiss it or try to reorient the person back to what we think of as reality. If someone tells you they saw their mother who passed away 20 years ago, the kindest response is not to say that is impossible, but to ask them what their mother said, to enter into that experience with curiosity and openness. Now, I want to be very clear about something. Seeing one or even two of these signs does not necessarily mean someone is in their final year. Bodies are complex, and many factors can cause temporary changes that resolve with treatment. A person who stops eating may have a treatable infection or medication side effect. Someone who becomes confused may have a correctable electrolyte imbalance. Breathing changes can be addressed with heart failure medications or antibiotics for pneumonia. This is why medical evaluation is so important. But when you see multiple signs occurring together, when they persist, despite treatment, when they represent a pattern of decline rather than an isolated incident, that is when you need to start having honest conversations with healthcare providers about prognosis and goals of care. And this is where I see families struggle the most. We live in a culture that wants to fix everything, that sees death as a failure rather than a natural part of life. We pursue aggressive treatments in very elderly or very ill people because we feel like we should be doing anything to extend life. But I have learned that there comes a point when the most loving thing we can do is shift our focus from cure to comfort, from prolonging life at any cost to ensuring that whatever time remains is peaceful and dignified. I want you to think about what kind of final year you would want for yourself or for someone you love. Would you want to spend it in and out of hospitals, undergoing procedures and tests, surrounded by machines and strangers? Or would you want to be at home or in a place that feels like home, surrounded by people who love you, free from pain, able to say the things you need to say and hear the things you need to hear? If you are noticing these signs in someone you love, I encourage you to talk openly with their doctors. Ask directly about prognosis. Ask what to expect in the coming months. Ask what can be done to maximize comfort and quality of life. These are difficult conversations, I know, but they are also acts of profound love and respect. They give your loved one a voice in their own care. They relieve you of having to make impossible decisions in a moment of crisis without any guidance. And they allow everyone involved to prepare emotionally and practically for what is coming. As I come to the end of what I wanted to share with you today, I want to leave you with this thought. Death is not the enemy. Suffering is the enemy. Loneliness is the enemy. Dying without dignity, without comfort, without the presence of those we love, that is what we should fear and work to prevent. But death itself, the natural conclusion of a life fully lived, is simply part of the cycle. When we can approach it with awareness rather than denial, with compassion rather than fear, we give ourselves and our loved ones the gift of a good death. Recognizing these signs is not about giving up hope. It is about shifting hope from the hope for cure to the hope for peace, from the hope for more time to the hope for good time, time filled with as much comfort and love and dignity as we can possibly create.